I was on a charity bike ride with my family down in Oxfordshire. The event was at Blenheim Palace. I actually was found unconscious on my bike, still attached to it. So I obviously had a stroke or brain hemorrhage while I was on the bike and sustained a head injury.
When a person has stroke, it's very important to follow that person up after they've gone home. So we should have a process where people have a review of any needs that they have and any actions that are required. GM-SAT stands for the Greater Manchester Stroke Assessment Tool.
So that's been a project that's carried on throughout the whole 10 years of the CLAHRC, and that's been developed into an evidence-based post-stroke assessment tool that thousands of patients have experienced.
Staff told us that although this worked very well, it probably needed adapting to use with people who live in care homes because they have quite different needs.
The toolkit, I think, has changed a lot, but it hasn't changed in its basic structure. So the range of questions that they had at the original is still there, but it's just added to and adapted as time's gone on.
There is a pro forma completed by professionals during the review. There's the summary report form that helps communicate the outcomes of the review, very in a patient-centred way. Then we have various guidance documents to help people understand and orient themselves to the different components. We also have easy access toolkits, so a communication support resources, trigger questions sort of asked in aphasia-friendly ways, components that can be sent to stroke survivors in advance of a review to help them prepare.
At the time, I would have valued that support in the reviews would have helped me to see where I was at.
It gives you the confidence to ask those difficult questions about, I don't know, maybe about relationships or something like that. You carry that forward into your everyday practice too. So when you see somebody, you're a bit more alert to it and you feel a bit more comfortable asking those difficult questions earlier on.
We developed it with people with stroke and with the staff who conduct the reviews, and we were really mindful of asking them about, try this out, can you use it, how long does it take, are you finding the information is really helping you to improve stroke care? And we're very pleased to say that the people being reviewed and the staff conducting the review, they said that they felt that this was very much something that was comprehensive, captured the important things, but short to do, and produced this report at the end, which was again brief but useful for the person with stroke to have, but also to send on to the GP so that they had a record of this person's needs and the actions required. So it can and has been used in people's own homes, where people are living in care homes, and sometimes people use it in NHS outpatient clinics. So it's really very flexible to be able to, where is the best place for the person with stroke.
The team at CLAHRC have developed it based on learning of people actually using it in practice. So I think it's really important that the learnings come from using the tool, and that's being built in as kind of an evolutionary process.
So we've made sure that all of the resources are freely available online. You can easily download them. We just ask for some basic information so that we can let you know about any updates and if anything changes with the toolkit.
It's a good feeling. Of course it is. You're better at doing your job. You're more effective, and you can help people recover more. That's what we're here for, isn't it?
Yeah.